Hello, my name is Eesha Acharya. My project is a study of peri-implantation cytokines to identify molecular signatures prognosis of pregnancy loss. Pregnancy loss affects about 15 to 25% of women, and some women experience multiple pregnancy losses prior to having a healthy baby. At most, 50% of pregnancy losses are unexplained, and one possible cause of these miscarriages are immunological or inflammatory. Inflammatory markers that circulate the bloodstream modulate immune responses, cell growth, and cell differentiation. A study by the Journal of Maternal, Fetal, and Neonatal Medicine proposes that successful pregnancies depend on a balance of Th1 and Th2 type cytokines. I'll be working with Dr. Lubna Paul and Dr. Samantha Simpson with the Department of Obstetrics, Gynecology, and Reproductive Sciences, Yale School of Medicine. I will help with analyzing the data and writing the research. The study aims to establish a normative cytokine data profile in the peri-implantation period for healthy reproductive age women undergoing in vitro fertilization as a strategy for infertility, and to identify cytokine signatures in the peri-implantation period that are predictive of pregnancy loss. It will be different from most studies because it is a prospective cohort study. It is hypothesized that a signature cytokine say collected at 5 to 6 weeks of pregnancy with first positive serum beta-HCG in infertility patients undergoing IVF will be predictive of pregnancy loss. Women are enrolled at the time of the first beta-HCG serum check, which is 10 to 12 days after the embryo transfer. Demographic information including obstetric history, infertility diagnosis, ovarian reserve status, and IVF cycle data will be obtained. Women that are enrolled will be followed for pregnancy outcomes to include biochemical pregnancy, clinical pregnancy, and ongoing pregnancy versus pregnancy loss. Stored serum samples will be taken and analyzed to establish normative values or ratios for biomarkers that have been previously shown to be associated with adverse pregnancy outcomes, including the levels of PD-L1, TNF-alpha, IL-10, and CXCL10 type cytokines. It's thought that PD-L1 is higher in healthy pregnancies, TNF-alpha attacks the embryo, and that CXCL10 and IL-10 help the embryo invade the maternal uterus. Then we will attempt to validate these findings on a previously existing cohort of women who have normally conceived and had serum drawn at 5 to 7 weeks gestation with known pregnancy outcomes. T-tests will be used to determine if cytokine values are significantly different between the healthy and pregnancy loss group. 26 patients so far were eligible for this study because they were healthy singleton pregnancies, clinical loss with normal genetics, or biochemical pregnancies. In ongoing pregnancies versus pregnancy loss groups, IL-10 first and last draw levels were both statistically significant. TNF-alpha was significantly higher in biochemical pregnancies compared to the control and clinical losses. Other cytokine levels are still inconclusive. More data is still being collected.